Hi, everyone. Welcome to your favorite show, your Teledoctor show. My name is Dr. Wilbrod, and today I want us to focus on one topic that relates to men. And we're talking about so many topics over the coming weeks, and these all relate to what really affects a man's health. What takes a man quickly to the grave? Can we prevent this? And I think there's cause to believe we can change all this. And your Teledoctor this month will discuss a number of topics. Today I'll concentrate on one. We know that most of our women out there, they are very good at seeking care. But there are many things that can actually affect men and they would not know. And I want to focus on this today. Hello, once more. Welcome to our Teledoctor show. And as I've told you before, we are continuing on this path of talking about men, learning about our health, and also doing something in order for us to change the course of the diseases and thus prolong your life. Today I want to talk about stroke. So one of the things that we know affects men differently from women is stroke. And in our setting, and I'm talking about Zambia, and could be also elsewhere, issues that affect men that come and lead to a stroke is mainly hypertension. Could also be issues of cholesterol, where there is a lot of cholesterol in your blood and it clogs your blood vessels, and that can also lead to stroke. So sometimes people don't even know that they have got hypertension, and your Teledoctor is here to tell you that you don't have to wait for that time when things have happened. So what are some of the things that men should be looking for in order for them to come and be checked in your Teledoctor clinic or anywhere where we come when we do wellness at your company? So one of the things that we do is to measure your blood pressure. So if you are a man out there, my advice to you is that at least twice a year, get your blood pressure measured. Also, especially if you've got a family history of hypertension, maybe your father, your mother, they could have had a stroke or they could have had heart problems, because what happens, and I'll talk about this next week, basically the heart is also affected because of high blood pressure, and I can explain in the next program how that happens. But to you, the message for today is that you, as good as you do for your car, once certain miles are reached, you go to Toyota Zambia, have your car serviced, oil checked. That's what we are saying at Teledoctor. This is known to reduce our lifespan. And by the way, for you who are managers, directors, and you are driving big car, you can only drive, I repeat, you only drive this well because you have got coordination of the hands, the legs, and your brain is intact. If that stroke strikes while you are driving or you are at home, you will no longer be able to drive well. And so even the job that gives you money, you will not be able to do it. All right. So it's very, very important, and we are encouraging all the women who are listening to us. If you've got a male partner, your brother, your uncle, encourage them today. If you need to tie them and bring them to Teledoctor clinic, you are doing a good job. You are saving a life, because this arrogance, sometimes men go to the hospital when they can't argue because they have had this stroke and they can't talk. And at Teledoctor, we feel so much at pain when people come so late. And so we don't want to threaten you. We want just to tell you the fact. Are you a man? One of the 5 things we'll be talking about this month, which can reduce your lifespan, is blood pressure. So my question to you before I go away, did you check your blood pressure in the last at least minimum 6 months? Did you check it? And the magic number, just before I go away, the magic number is 140 over 90. There have been arguments and you can go into text, but for the sake of the general well-being of somebody, if your BP is above that, there are measures we can take. It's not always, and I know men are afraid of side effects of the medication, and I think that is understood. But there's so much we can do. Your diet, there are so many of us throwing salt into something you have not tested. We are saying that's not the way to go. Again, exercising. So our tummies are like reaching the sky. Our weight, that is not good for your health. In fact, when I was growing up, people were saying if you are fat, you are big, that is good health. Now we have known that is what is leading to what we are calling lifestyle diseases, and hypertension is one of them. So I want to repeat, your teledoctor is concerned that we are losing so many young people prematurely. In fact, WHO says if you die before 60 years of age, that is premature death. And hypertension is one of them. It's over 20% of Zambians who have got hypertension, and it could be more in the HIV population. And the sad news is that we don't even know. So don't say we didn't tell you. You have to tell your doctor on Teledoctor what your blood pressure numbers are. Thank you for listening. Bye for now.
To advertise on the Teledoctor show, please contact 09799040046 or email us on info@teledoctor.co.za. Teledoctor, healthcare in the palm of your hands.
This week, we want to emphasize the topic that is very important to all men, but also close to the women as well, because if your men are affected, we are all affected. And this is prostate cancer. What is it? And today on my show is Professor Kasondevowa. Welcome.